OrthoED is a comprehensive orthodontic education program that offers a range of courses to help dental professionals improve their skills and knowledge in orthodontics. The Mini Masters program is one of the most popular courses offered by OrthoED, and for good reason. There are many benefits of the OrthoED program, and I shall be asking Robin to discuss this with you from all the feedback that she's received from our many doctors who have done our Mini Masters program. Robin, one of the most common questions I understand from our doctors is how do we support them during and after their course?
We have several support options. We can schedule one-on-one 1-hour Zoom sessions for the doctors with our specialist orthodontists to discuss the treatment planning. And we also have a portal, which is a secure web-based portal where doctors can upload their patient information along with treatment questions, which will all be answered via email. Our portal provides a history of all of your questions and the answers. We can also provide you with treatment planning optimisation for clear aligner therapy, which is also done through a secure web-based portal. We support you from the beginning to the end of your patient's treatment, and our support is extended to team support, where we will help to set up systems in your practice and train your staff to seamlessly integrate orthodontics into your practice. Remember, your success is our success.
Robin, another frequently asked question that I've heard is how often do I have to attend lectures, and are they all face-to-face?
We're very aware that everyone learns differently, so we provide face-to-face learning for the doctors who prefer to be in the classroom, and there's also the live stream option for doctors who find it difficult to travel. Modules are scheduled between Melbourne and Brisbane, with our aligner modules also having an option in Sydney. So with the aligner modules, you have an option between Melbourne, Brisbane or Sydney. Doctors will attend modules 1 to 4 in year 1 and modules 5 to 9 in year 2, and on average, they're every 3 months.
And Robin, what happens if someone is unable to attend one of those modules?
We provide prior recordings for all of our modules, which are accessible on our portal for 3 months from the scheduled date of each module. You may like to watch the recording and attend the module the following year, or alternatively, we can send you the link and you can join the live stream option if you choose.
Robin, I understand that you get asked a lot. What is the difference between the Mini Masters program and the Postgraduate Diploma?
The curriculum's identical with the Postgrad Diploma and also the Mini Masters, the only difference being you do need to complete a multiple choice assessment on completion of each module, which is all done on the portal. You must submit 2 cases for patients who have been in treatment for a minimum of 12 months. They can still be in active treatment. However, we do need to have the treatment documented and we do need to have regular photographs. The final assessment is a 45-minute Zoom session done with Jeff himself, where Jeff will show you a couple of cases and then you verbally diagnose and treatment plan them.
And what's the reason why people would do the Postgraduate Diploma?
The Postgrad Diploma will increase credibility with your patients, increase your confidence, and the feedback I receive from doctors is it's a really good way for them to go and revise what it is they've learnt. So they'll go back in and have a look at the recordings which we offer, and they need to research the answers for their questions for the assessments.
If you're looking to improve your orthodontic skills and knowledge, then the Mini Masters program is definitely worth considering. Thanks for watching, and be sure to check out the OrthoED website for more information about the Mini Masters program and all of the other courses that are offered by the OrthoED Institute.